present, civil society organizations, members of the National Planning Committee, directors of my ministry and Ghana Health Service and all agencies in health, friends from the media, distinguished ladies and gentlemen. I had a very bad night, and minus this program, I shouldn't have actually come out of my bed. But because of the significance of this event, I just had to move out and just come to do this and either go to see a doctor or get back home. So that underscores why we are all here and what we should do from here. We are not only going to test ourselves, but to advocate for others to try to test. Now I stand before you today with immense pride as we gather here for a momentous occasion like this to launch the HIV self-testing program in Ghana. I must say that the timing and the theme, test yourself, know your status, for this occasion is very appropriate considering the recent increase in the number of HIV and AIDS incidences Ghana has recorded. I therefore deem it a great pleasure and privilege as the Minister for Health to address you all as we mark this important milestone in our efforts to combat HIV and AIDS. Nana Chairman, distinguished ladies and gentlemen, the availability of HIV self-testing kits is a significant step forward in our quest to create a healthier nation. By removing barriers to access, we are empowering our citizens with the knowledge they need to protect themselves, their loved ones, and the wider community. Nana Chair, globally, it is estimated that only about 70% of persons living with HIV are aware of their status. This has become a major hindrance in the global strategy toward ending AIDS by 2030. For example, in our country, Ghana, the Ghana AIDS Commission reports that there are more than 350,000 persons living with HIV. However, only about 71% of them are aware of their status. The remaining 29%, consequently, pose a major public health concern as they may unknowingly be spreading the virus. And despite the numerous global efforts and progress made in raising awareness and implementing preventive programs. Distinguished ladies and gentlemen, to bridge the gap in the testing coverage among hard-to-reach populations, Ghana adopted HIV self-testing in its consolidated guidelines for HIV care. The HIV self-testing is one of the newest innovations in the range of strategies aimed at encouraging persons to know their status. Currently, HIV testing coverage 1,971,381 out of a target of 1,906,620 were tested for HIV in 2022, representing 104% target coverage, a marginal rise from the 103% achieved in 2021. This is the National AIDS Control Program 2022 report. The lack of knowledge hinders our ability to provide timely treatment, support, and care to those who need it most. The availability of HIV testing kits addresses this critical gap in our healthcare system. Testing is the foundation upon which our entire response to HIV/AIDS is built. It is a gateway to prevention, treatment, care, and support services. When individuals know their status, they can make informed decisions about their health and make the necessary steps to protect themselves and their partners. It is through increased testing that we can effectively identify new infections and link individuals to the comprehensive care they require. It ensures that every Ghanaian, regardless of their socioeconomic status, can access confidential and accurate testing services. By doing so, we strengthen our collective efforts to curb the spread of HIV and reduce the stigma surrounding the virus. However, let us not view HIV testing as an end. Rather, it is a means to an end, an opportunity for us to create a society that supports and cares for those living with HIV/AIDS. It is our duty to ensure that individuals who test positive are provided with the necessary treatment, support, and counseling services for a healthy and fulfilling lives. Chairman, distinguished ladies and gentlemen, as enshrined in Goal 3 of the Sustainable Development Goals, specifically Target 3.3, this goal seeks to end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases by the year 2030. In our country, the National Health Policy 2020, themed Ensuring Healthy Lives for All, derives inspiration from the directive principles of state policy in Article 34(2) of the 1992 Constitution of the Republic of Ghana, which, among others, requires that state to ensure the realization of the right to good health care for people living in Ghana, irrespective of color, race, geographical location, religion, and political affiliation. To operationalize these overarching frameworks, the Ministry of Health, in consultation with its relevant stakeholders, has developed a national HIV and AIDS and STI policy that provides the framework for the development of HIV/AIDS and STI policies and programs in our country. It seeks to create a favorable environment for all aspects of HIV, AIDS, and STI prevention, care, and support. Government of Ghana's financial commitment to HIV control has been complemented by donor support for capacity building and logistics supply. For the period 2021-2023, under the grant cycle, government support to the National AIDS Control Program amounts to about $30.2 million. The Ministry of Health, as a result, had procured an estimated $4.9 million worth of HIV commodities in 2022, which has contributed significantly to stock situation. Though there are intermittent commodity constraints, I wish to assure you that the Ministry of Health will continue to engage its key stakeholders to ensure the regular availability of stocks, medicines, and logistics in our efforts to combat HIV and AIDS. Today, we embark on a new chapter in our fight against this epidemic by launching the HIV self-testing kits program. This program aims to expand access to crucial HIV testing services, thereby increasing early detection, reducing stigma, and ensuring timely intervention and treatment for those in need. I therefore urge all Ghanaians to take advantage of this opportunity and get tested. In fact, I got tested just last 3 weeks by self-testing in the comfort of my bedroom. Fortunately, I didn't need to go to do any confirmation. Let us work hand in hand to reduce the number of new infections, ensure access to treatment for all who need it, and ultimately strive towards an HIV-free generation. Nietzsche, distinguished ladies and gentlemen, permit me to express my heartfelt gratitude to the National Planning Committee, the Ghana Health Service, the National HIV and AIDS Control Program, the Ghana HIV and AIDS Network, the Ghana AIDS Commission, PEPFAR Ghana, the Global Fund, UNAIDS, and all other dedicated development partners, institutions, and individuals who have worked tirelessly to make this initiative a reality, including myself. Your unwavering commitment to the well-being of our people is truly commendable. Today, as we launch the HIV self-testing kits, we must recommit ourselves to promoting the culture of compassion, understanding, and non-discrimination. As key stakeholders, we are obliged to foster an environment where individuals living with HIV and AIDS are embraced rather than stigmatized. It is through unity and solidarity that we will overcome this challenge. I therefore wish to encourage each one of you to fully support the development of the HIV self-testing case program countrywide. Let us seize this moment and make a lasting impact on the lives of our people. Together, we can achieve our vision of a Ghana where every citizen can enjoy good health and well-being for national development. Chairman, distinguished ladies and gentlemen, on behalf of the government of my country, Ghana, and the entire sector players, permit me at this point to officially launch the HIV testing kit program.